Hi, I'm Chris Oliver, Chief Executive at Lancashire and South Cumbria NHS Foundation Trust. Welcome to my podcast. Each episode, I speak to inspirational colleagues to bring listeners an insight into the variety of mental health, learning disability, autism, and community services provided by the Trust. Hear firsthand what it's like to work on the front line of our NHS. This is In Conversation with the CEO. So it's great today to be joined by Shaesta, who's one of our CBT therapists within our Talking Therapies team based in our Pennine network. So great to meet you, Shaesta.
Hi, Chris.
And it'd be great. You've been in the NHS in our trust for about a year and a half. That's your first entry into the NHS. Just talk to us about what made you want to come to the NHS and a bit about your role.
Okay, thanks for having me on today. I was really looking forward to this podcast. So I suppose my journey started in psychotherapies working within the NHS from January 2022. So before that, prior to that, I was working as a social worker, and I've also worked as a university lecturer and in primary teaching. Now, what initiated my journey towards psychotherapies, and in particular with the NHS, was in October 2020, my father passed away from COVID, which was quite a difficult time as a community and just as a family as well. The grieving process was very complicated. Yeah. Now, that prompted a certain kind of energy within me where I felt like I needed to do something to help the community to overcome some of the mental health challenges that they were facing. Yeah. Now, COVID was just something that kind of resurfaced those inequalities. We knew that that was happening all along. There's decades of research that says that people from the Black, Asian ethnic minorities experience racial and mental health inequalities more than any other ethnicity out there.
Yeah.
Okay. So I just decided to apply for the trainee CBT post. I was quite surprised and taken back when I was offered an opportunity to train. So I started in January. And from there onwards, I just kind of continued with my journey to become now a qualified, accredited CBT therapist.
That's fantastic. And out of such a horrendous life event of losing your father to come and want to join into the NHS and LSCFT is fantastic. So yeah. Thank you for that. You talked about Talking Therapies, and nationally, our Talking Therapies services have just been rebranded into Talking Therapies from IAPT. Do you want to talk to us a bit about what Talking Therapies means to you and your role?
Yeah, absolutely. So the IAPT service was first established in 2008, and that was established as a way of, by the Labour government at that time, where they found that there was a lot of people out there who were experiencing significant mental health illnesses, and as a result, that was having a massive impact on social and economic factors. So therefore, the government invested a lot of money and a lot of skills and expertise to develop a team, a psychological team, for them to be able to create a service across the country that will be able to support people with their mental health illness. So the rebranding took place in May this year. So it was formerly known as, our team was known as Minds Matter. So the rebranding took place in May. And as a result of that, it's called NHS Talking Therapies, and it's got a tagline for anxiety and depression. And it's a service where people can self-refer over the telephone, online, and it can be referred by the GP. And you will then be offered an assessment. So anybody over the age of 16 and in South Cumbria, I think it's over the age of 18, will be accepted for a referral. A telephone assessment will take place, and then they'll be able to assess whether the person is suitable for the type of therapy. We have a range of therapies in our service. So we've got counselling, we have CBT, we have IPT therapy as well, interpersonal therapy, and EMDR service as well, practitioners who are qualified in that to deliver that. Really, the purpose of the service is to be able to treat mild to moderate mental health illness within the community and within NHS Talking Therapies.
Fab. And we know within the communities within Lancashire and South Cumbria, we're really lucky to have really diverse communities, but we know that some of our communities, especially our BAME communities, the inequalities is there. you've been leading a specific piece of work around addressing inequalities. How have you done it around that accessing of mental health services and some of the stigma that's seen with accessing mental health services? Can you just talk us about that?
Yeah, of course. I think, first of all, it's important to mention that 1 in 4 people across the country will experience mental health illness at some point in their lives. And some of the research shows that almost 61% of those people won't actually come forward to access therapies. And that's regardless of your diverse ethnic background. And also 71% of those people will be very reluctant to go up to their employer and say, I have a problem, because of the the stigma, and obviously there's some worry and concern about some of the negative impact that's going to have, whether they're able to perform their job or not. Yeah. Now, when we look at the statistics from the Black, Asian, ethnic minority community, we find that it was quite interesting actually, and quite sad as well, if I'm honest, to kind of look at the research saying that for women who are from the BAME communities, they are 4 times more at risk of dying through childbirth compared to the white counterparts. Okay, there's more risk of women from the Pakistani backgrounds or the Indian background to be committing suicide, so they have much higher risk compared to the white counterparts. And people who are Black will be detained in the mental health institutes under the Mental Health Act 4 times more than the person who is from a white ethnicity. There's a real problem here. Yeah. And from my experience of having to cope with the grief during COVID, that became really transparent. Okay. And there was lots of national news and papers that have come out saying that actually there is a problem here. Now, there has been a barrier for people from the BAME community accessing the service. Yeah. And the research within the IAPT last year also published a report saying that people from the BAME communities will not access psychotherapies, are less likely to access psychotherapies, and the GPs are less likely to refer them to psychotherapies as the first treatment protocol for mental health illness. Okay. So I suppose we kind of know about some of those inequalities. Coming from a social work background, all that was quite apparent to me as well. Yeah. And as a social worker, many social workers out there, and I suppose people who work within the trust are very passionate about social justice and equity and fairness in terms of access to treatment and the choice of care that they receive. So I suppose for me, I then decided, okay, I understand that those facts are there, that research is there. What can we do about this? So I joined the BAME champion role in April this year, which was fantastic. But from there, I had this vision of, okay, what can we do as clinicians here to kind of understand what those barriers are? So one of the most effective ways, and I call it action research, is to go out on the grounds and actually go into these communities where people feel safe in their environments and to talk to them about psychotherapies. So that's how the journey towards making psychotherapy accessible came about within my role and within the team that I'm working in.
That's fantastic. And we know we've had our own reports done around how we are interacting with our real diverse communities, and we don't get it right all the time. So it's really important. I suppose one of our trust values is we're always learning, isn't it? And how do we, so the work that you've done within the Pennine, how do we then make sure that this gets rolled out? Because this sounds like absolutely the practice that we should be doing, and getting into communities and being that bridge that people, so that people talk about good mental health, and it's absolutely fine to talk about mental health. And how, if we've got colleagues that are listening into now around how some of the pitfalls or some of the learning that you've taken through from your journey, what would they be now?
I suppose if I share some of the work that we've been doing, so myself and my colleague Hina Ayub, we work in the Burnley team, and we've been massively supported by our managers, Chloe, and Catherine and also Sophia and Katri. They've been on this from the beginning, and I have to massively say thanks to my supervisor Emma, because she's always made me believe when I've not believed in myself.
Yeah.
So it's important to say that. So your team, like you said, is really important.
Yeah.
Your team is what makes any kind of work a success, right? That's how those are my beliefs, and I think that is actually what's happening here.
Yeah.
So the work that I've done is we have been since May this year, up until actually did a little forecast, kind of just a review of what the work that we've been doing. So we have been out into the community, so that includes the mosques, children's centres, schools, and we have been delivering 90-minute workshops, interactive workshops, which have been culturally and at some point spiritually adapted from a clinical perspective to help them understand that actually from a cultural perspective, also from a spiritual perspective, seeking help for your mental well-being is an important thing.
Yeah.
It, if anything, is an act of worship. Yeah. Okay.
Fantastic.
So I think when you are working with diverse communities, it's important to meet them where they're at.
Yeah.
So we've been delivering, myself and Hina have been delivering 90-minute workshops, one each month. Okay. And well, actually, we've been a sneaky. Yeah, so group workshops. Okay. So the largest group workshop that we had was at a local mosque, and 90 women attended that event, and that was on a Sunday. So I get some, clinicians will be like, oh, it's working on a Sunday, but again, it's like, let's meet people where they're at, where we know they're going to be able to, attend, and it's there. So 90-minute workshop talking about depression, anxiety, again, culturally adapting the material. Now, as you know, I've been a lecturer in the past, so I didn't just kind of talk. We had a lot of group work going on. Fantastic. So we gave them scenarios. So trying to manage, we were actually really in awe looking at how many people attended that. So trying to work out how to deliver a group work with 90 women was a bit of a task, but we did it. It was great. So from those workshops, what we're finding is that we have actually connected with 239 women in 5 months, just having that delivery of 90-minute workshop. And then we've also been increasing the referrals into the service because they are now interested. 92% of these women don't know that the service exists. Yes. So that's something that Com's working on, something that we're working on as a team. So that's it. So this is the whole drive behind it. Let's get out there. Let's show people out there what we have to offer so that we don't reach that crisis point, and we can hold them in a safe space within the NHS so that, it's equity, isn't it? It's that fairness.
It's fantastic.
So it is exciting. I'm really excited about it. I have been really excited, and that's what keeps me going. And the feedback that we've had from these women and these community leaders has been really quite phenomenal. Actually, they've actually been coming to us. So we've got 4 other projects lined up already. People have been like, oh, can you attend this? Can you attend this? And then obviously that has to go through to my manager. If we have capacity, we're able to kind of deliver those. So the idea is that, yes, let's deliver as much as we can. So 239 women we've reached. Now, that's not just 239 women. Those women will go to their families.
I was just thinking myself.
It's that real ripple of positive effect, isn't it? And that's what it's about. And not only that, we've networked with 60 organisations by attending these promotional events that they might have to offer. The health mailer that's going on. I think you were at the Chai Centre, weren't you?
I was just going to ask about, so have you been running anything from the Chai Centre?
Yes, absolutely. Brilliant. So we have got a clinic now based at the Chai Centre, and so we've got some counsellors working from there, and we have got in the pipeline the delivery of a wellbeing course, which is currently, I'm looking at it with Hina, to culturally adapt the material. So we're able to deliver it in Urdu Punjabi. So most of these sessions that we go into, I'm speaking in Punjabi and Urdu. So it's a whole buzz of energy.
It really feels like we're taking the trust and the services into the community. Absolutely. And making them community relevant for each community, which is so important.
Yeah, the community is our strength, isn't it? Really?
Absolutely. Without the community, we're nothing, are we? We are. That's what we're here, absolutely, to provide services for.
And this whole rhetoric of, and I've mentioned this when I was interviewed for the article that we did on the Shine magazine, like these communities are hard to reach. that doesn't sit right with me.
No, I agree.
You know,
Yeah.
and I think that's a very deficit way of looking at it. I mean, the communities are out there, and I'm quite fortunate. And
We need to change our approach of how we reach.
Absolutely, and we are
Totally.
doing, Chris.
Yeah.
We are doing, and I think that's what's been really good about working in the team that I'm in, is that everybody's very supportive of the work that's going on, and it's helping us just kind of move along and think, yes, there's so have this whole vision. So just imagining. So the idea is by April 2024, we've got this target, and I like targets.
Yeah,
you
that's
know.
good.
I like
Bit of
targets.
competition,
Yeah.
that's always good.
To reach up to 500 people from the ethnic minorities, and I'm thinking, well, we have 9 teams across LSEFT.
Yeah.
Just imagine if that was 500 people, and other teams were able to kind of replicate some of that work. Now, I'm not very good with maths, so you might have to help me out here. Right, okay. Putting you on the spot. So if it's 500 people, so let's just say, and that's 9 teams, that will probably be, I've got figures here. Just let me have a look at my figures. So yeah, I think that would be 4,500 people if we all work collectively on it.
It's fantastic. It's an aim to work to, isn't it?
Absolutely.
It absolutely isn't something to galvanise, I think, our Talking Therapy team. And then seeing that ripple further from Talking Therapies into our community teams, our physical health teams, as well as our mental health team. So it's earlier on, you mentioned around being the BAME champion.
Yes.
Just talk to me a bit about what that means to you and why that's so important for you.
The BAME champion role, we've got champion roles across the trust, and that's not just for the BAME representation. We've got people who are there for long-term conditions, for safeguarding. So the trust has a certain created this title where you attend these groups, these meetings, and you look at the criteria that we've got working with. So, for example, we work with the BAME champion roles. We're looking at the positive guide practice to see how we are we meeting the national guidelines? Are we delivering these the therapy reflective of the community, or is there a barrier here? So all the champions will have their own set criteria that they work with. We meet once a month online, and a fantastic team that we've got, and like I said, me and Hen have taken the lead on just the outreach work. But there are we've got an amazing team where we are looking at the interpretation material. We're looking at, working with comms to try and get the message out there in different ways, to say that actually translated in different ways, maybe some videos. So there's lots of work going on in the background, and it's an amazing team, absolutely.
And we talked about ripples earlier. That's rippling out that work across the organisation, so much wider than just Talking Therapies as well.
Yes, absolutely. Yeah. There's I think 10 of us actually from different localities that joined together. So it's not just the Pennine team here. We've got other teams who are coming together for this meeting, led by Katri, and supported by Katri as well, which is the clinical lead. So it's going in the right direction.
Totally. Brilliant. That's really good. Yeah. And we were talking just before we started the podcast that you've been, you're a finalist in our this year's Time to Shine Awards.
Yes.
So, and I can absolutely see why you are a finalist. So I wish you the best for the awards night, which is coming up later, November, in middle of November.
Yeah.
So it's just been fantastic, Shaesta, talking to you about the services you're providing, the transition into the NHS, and you feel like that it feels, listening to you, that you've really found a vocation in this, and bringing that link to communities is just absolutely amazing, and your passion and drive is infectious. It's fantastic.
Thank you. Yes. It's,
really humbled chatting to you. I think it's fantastic what you do.
Thank you so much, Chris, for having me on.
Perfect. Take care.
Thank you. Bye.
Bye.